Welcome to the CMSA Foundation poster presentation on evidence-based case management practice improves outcomes. My name is Susie Ratterree, and I have been a nurse case manager for over 25 years. I have practiced in multiple settings, including workers' compensation, disability management, group health, and as an independent consultant. In my most recent position, I was on a team that conducted research on the effectiveness of case management on functional outcomes, successful return to work, and return on investment in disability disease management. It has been my pleasure to serve as a secretary for the foundation for the past 2 years, supporting the mission and vision. My colleague Sheilah McGlone and I discuss how evidence-based case management practice and research improve outcomes.
Thank you, Susie. My name is Sheilah McGlone, and I also welcome you to our Foundation poster presentation. I'm proud to be a Foundation board member for 2 years. I am a certified nurse case manager, and I've been a CMSA member for 22 years. I have over 25 years of case management experience encompassing commercial and government-funded programs with a primary focus and dedication to working with underserved populations. Within my 20 years as Director of Case Management Medicaid at Hudson Health Plan MVP, I oversaw a special team of healthcare professionals and participated in the creation of the successful Feet to the Street Westchester Cares Action Program, an award-winning integrated care management health home. I am dedicated to the philosophy and delivery of a fully integrated case management model where one case manager links care coordination across all domains of health. I am currently sharing my expertise as a consultant and case management trainer. The CMSA Foundation is a charitable, not-for-profit organization created to support education, research, and professional development for case management professionals. The foundation was founded by case managers for case managers and is solely funded by donations. Through our donors, we were able to offer a scholarship for the CMSA Integrated Case Management Training, awards for research and process improvement programs, and a Peggy Leonard Public Policy Grant created with the intent to raise visibility and public awareness of our profession. This year, we were able to offer scholarships for conference registrations that included a 1-year CMSA membership, all due to our generous donors.
It has been my pleasure to serve alongside the 2019-2020 energetic, innovative, and dedicated board to further the mission and vision of the Foundation. There are many models of case management practice. However, to date, there is no theoretical framework that demonstrates the effectiveness of the models or interventions. The case managers called upon to collaborate with all stakeholders to improve outcomes, help the client navigate through the ever-changing reimbursement landscape and rapidly changing delivery of health care, as well as advocate for the client. It is important for case managers to develop improved practice processes and conduct research that demonstrates increased quality of care, improved outcomes, and return on investment. It is through this work we can advance the practice of professional case management and improve outcomes.
Our poster will help you understand the importance of recognizing the need for process improvement strategies within your practice. You will be able to create processes to help reduce fragmented care, assist with transition of care, and improve our patient outcomes. You will learn how evidence-based research and standards of practice empower case managers to utilize established clinical knowledge to validate return on investment. You will also take away an understanding of how to access resources to develop process improvement and research programs. We all know Florence Nightingale. Did we know she was a British social reformer and statistician? She was a trailblazer who raised the standards for nursing during the Crimean War. Her evidence-based research documented the importance of sanitary living conditions and need for improved personal hygiene for British soldiers. This change decreased mortality in a very short amount of time. She made rounds every night to offer comfort and peace to her soldiers. Her fundamental nursing theory of person, environment, and health are still relevant and continue today throughout the current nursing curriculum. Evidence-based case management practice. Case managers bring clinical experience to the table, but we should all incorporate evidence-based practice into our own practice. The case manager's clinical experience should be integrated with the opinions and vast experience of experts, practice analysis, and roles and functions research. Always include patients' values and preferences. So what is evidence-based practice? It's comprised of many sources of information: your clinical expertise, your experience, your education, your clinical skills, best research evidence, clinically relevant research conducted using sound methodology. Review a well-done systematic review derived from multiple studies identified through a comprehensive literature search. Patient values and preferences, including concerns, expectations, and cultural beliefs. Cultural diversity training should always be incorporated in all case management education. Steps for case management process improvement. Determine your goals. What will you be evaluating? What do you want to improve? Always assess your institutional rules, roles, and tools. Ask permission. Consult your leadership. Identify who will be helping you. Develop an action plan and then implement that plan. Measure and evaluate. Evaluate and reevaluate. Come to your conclusions. Common areas of health demonstrating improved patient outcomes through process improvement studies. Transition of care planning. Difficult to move complex patients from one setting to another safely. Lots can happen. Identify the root cause of any breakdown through review of data. Delay in transfer. Lack of medication reconciliation. Lack of a discharge report. And we all don't want to hear that phone call. I lost my patient. Integrated case management models. CMSA ICM model utilizes a numeric scoring system to track the patient's domain of health, including social determinants that require immediate need for intervention in progress. This program sets the stage for perfect research and return on investment as outcomes are reviewed through the data. Quality of life, patient satisfaction. Initiate and review surveys. They're used in hospitals, managed care plans, and other agencies. Create your own within your department. State and federal agencies utilize patient satisfaction surveys to evaluate quality of care. Compliance with state and federal quality measures. Critical to the monitoring of the care our patients receive through evidence-based medicine.
The Foundation created the Case Management Improvement Practice and Research Awards to recognize the individuals, groups, and organizations that are developing innovative practices or using findings from research to advance case management practice. The 2019 recipient of the Case Management Process Improvement Award was Pathway Home, a behavioral health organization that works to provide transition from acute care to integration back into the community after an extended inpatient stay. This process included an interdisciplinary team of inpatient staff, family, and community providers to ensure the client is successfully integrated back into the community. As you can see, they experienced improved readmission rates, improved client behavioral changes in attending medical appointments, medication adherence, and improved quality of life. The 2019 Research Award was Dr. Kelson Zare, who investigated the performance across multiple units in a hospital setting that implemented a new case management model. The results indicated case managers should be involved in the implementation or change of process to obtain better organizational outcomes, employee engagement, and impact on cost reduction, improved quality of care, and patient satisfaction. We encourage you or your organization to look at the great work you do and submit your program or research for consideration. All of you are doing great work, and we can all benefit from improved practice, processes, and research. Thank you for your time. Sheilah, do you have any final comments?
As case managers and healthcare providers, we are dedicated to helping patients from all walks of life, one person at a time. But as case managers working during these unsettling times, we're all heroes. Let's not forget how the review of aggregated data is critical to move forward with process improvement and research leading to better patient outcomes. Thank you for taking the time to review our poster.